Today we will discuss about the anterior triangle. This is the face and this is the neck region. The neck, which is when see from the lateral view, it is quadrangular in shape. It is start from the symphysis menti to the upper border of the sternum. It is called the manubrial suprasternal notch, and this is the anterior midline symphysis menti to the suprasternal notch. And when we see on the back side, it is the posterior median line and it divided by the one muscles. It is the sternocleidomastoid muscles that divide the neck into the anterior triangle and posterior triangle. Anterior to the sternocleidomastoid, it is called the anterior triangle. First of all, I have reflect the skin of the total neck region and face region, and I will reflect the skin of the head and neck regions. Here, I already cut the some portions of the platysma as well as there is a investing layer of deep cervical fascia. This is the portions of the platysma muscles and investing layer of deep cervical fascia. Here you can see this is the portions of the investing layer of deep cervical fascia and platysma muscles. And this main things which makes the roof of the anterior triangle: skin, superficial fascia, investing layer of deep cervical fascia, platysma muscles, which making the roof of the investing anterior triangle. Now I will reflect the uh, roof, and you can see there is a this is the muscles. It is called the sternocleidomastoid muscles. It has a two belly. Here you can see this is the sternal head, and this is a clavicular head of the uh, sternocleidomastoid muscles. And this is the after reflecting this, you can see this is a superior belly of homoid. This is the anterior belly of digastric. This is the posterior belly of digastric. These are the three muscles: superior belly of homoid, anterior belly of digastric, and posterior belly of digastric. This divide the anterior triangle into the further 3.5 triangles. The here you can see both the sides of anterior belly of digastric. This is the right side of anterior belly of digastric. This is the left side of the anterior belly of digastric, and this is the hyoid bone. So this unpaired triangle, which is lies inside the midline, it is called the submental triangle. And this submental triangle, which contains, this is the very small lymph node. It is a submental lymph nodes, and there is a one vein. It is called the antejugular vein, and this antejugular vein here already cut the remaining portions. It is the submental vein become continuous as the antejugular veins. So here you can see this is a portions of the antejugular veins, and these are the two content: submental lymph nodes and submental vein are the content. Floor of this triangle, which is formed by the muscles. Here you can see there is a one muscle. It is called the mylohyoid muscles, which making the floor of the submental triangle. So the submental triangle, it is an unpaired triangle situated into the midline, bounded both side apex, which is formed by the symphysis menti. On each side, it is bounded by the anterior belly of digastric. This is a right, and this is a left anterior belly of digastric. Base, which is formed by the hyoid bone. Roof we already cut, and it is formed by the skin, superficial fascia, investing layer of deep cervical fascia, and platysma muscles. All triangle, the roof is same, and the floor, which is formed by the mylohyoid muscles on the and content we already discussed. It is the submental lymph node and submental veins. Now we will discuss another triangle. It is called the digastric triangle. This digastric triangle, which is formed by the just below to the lower border of the mandible. Here we already cut the lower border of the mandible to see the uh, deep structures. So the base of this digastric triangle, which is formed by the lower border of the mandible, that level we have cut the mandible, and from the angle of mandible to the mastoid process, you have to draw the line, and this triangle, it is called it is the upper boundary of the digastric triangle. Anteriorly and inferiorly, it is bounded by the anterior belly of digastric. Posteriorly and inferiorly, it is bounded by the posterior belly of digastric. Along with it, there is a one muscle. It is called the styloid muscles. So this digastric triangle, which is further divided into the two parts by the anterior part, it is called this part, which below to the lower border of the mandible, it is called the submandibular triangle, and the posterior part here on that side, just in front of the ear lower part, the portion, it is called the parotid part of the digastric triangle. Now the digastric triangle roof, it is the same things: skin, superficial fascia, investing layer of deep cervical fascia, platysma muscles. The floor of the digastric triangle, which is formed by the anteriorly this muscles, which also makes the floor of the submental triangle, it is the mylohyoid muscles. Once just this mylohyoid muscles, behind to these muscles and deep to it, here you can see there is a one muscles, it is a hyoglossus, and the most posteriorly there is a one muscle just on the posterior surface of the pharynx, it is the middle constrictor muscles. So the middle constrictor, on the middle part there is a hyoglossus, and the anterior part there is a mylohyoid muscles, which makes the floor of the digastric triangle. The digastric triangle we already discussed. Anterior inferiorly it is bounded by the anterior belly of digastric, posteriorly and inferiorly it is bounded by the posterior belly of digastric along with the stylohyoid muscles. And this digastric triangle, which contains the facial vessels, this is a facial artery and this is a facial vein, and this facial artery, it gives the uh, submental branches. This is a submental branches, and also you can see there is a the submandibular glands, submandibular lymph node. We have already removed the submandibular lymph node, but facial vessels, submandibular lymph node, glands. This is the artery, and also you can see here there is a one nerve. It is a hypoglossal nerve. So here you can see this is a hypoglossal nerve, and this hypoglossal nerve, which is wind around by the one artery, it is called the lingual artery. So the lingual artery, hypoglossal nerve, and submandibular gland, facial vessels, as well as you can see there is a one branch which is coming from the inferior nerve. It is a mylohyoid nerve. So this is the mylohyoid nerve, and this mylohyoid nerve and vessels both are the branches. This mylohyoid nerve and vessels are the branches of inferior nerve. So here you can see this is the uh, inferior nerve, and this inferior nerve which gives the mylohyoid nerves, and this mylohyoid nerve supplies to the anterior belly of digastric, and it also supplies to the mylohyoid muscles. So the mandibular nerve, it is the main nerve for the derivative of the first pharyngeal arch, and that's why mandibular nerve gives the inferior nerve, and above one this nerve, it is a lingual nerve, and this lingual nerve inside there is a attachment of the one ganglion, it is submandibular ganglion. So inside the submandibular triangle, basically the structure seen inside the submandibular triangle are the submandibular lymph node, submandibular gland, submandibular ganglion, then facial vessels. This is a facial artery. Here you can see this is a facial artery wind around to the deep part, and this is a facial vein. Here you can see this is a facial veins, And also artery, it gives the submental arteries, and there is a nerve to mylohyoid. Here you can see this is the nerve to mylohyoid, and veins, vessels, it is a branch of inferior nerve and vessels. And the submental artery, it is the vessels, it is a branch of facial vessels. And also you can see there is a inside the triangle, it is the one nerve, it is a hypoglossal nerve. Here you can see after reflecting this, this is a hypoglossal nerve, and there is a lingual artery. The posterior part of the digastric triangle, it is called the parotid part. This is the parotid part of the digastric triangle. And this parotid part of the digastric triangle, it is the deepest structure, it is the external carotid artery. After that, there is a superficial, there is a one vein, it is the retromandibular veins. And above to it, there is a, inside the parotid gland, it is the facial nerve. But the structure you can see inside the parotid part, it is the lower part of the parotid gland, as well as the external carotid artery, retromandibular veins are the structure you can see inside the posterior part of the parotid part of the submandibular triangles. Now we will discuss about the another triangle. It is the carotid triangle. The carotid triangle, which is above, anteriorly and superiorly, it is bounded by the styloid and posterior belly of digastric. Anteriorly and inferiorly, it is bounded by the superior belly of homoid, and the posteriorly, it is bounded by the anterior border of the sternocleidomastoid muscles. So, for the better visualizations, this triangle, it is considered as a carotid triangle. Anteriorly and superiorly, it is bounded by the posteriorly and superiorly, it is bounded by the uh, anteriorly and superiorly, it is bounded by the posterior belly of digastric and styloid. Anteriorly and inferiorly, it is bounded by the superior belly of homoid, and posteriorly, it is bounded by the anterior border of sternocleidomastoids. For the better visualization, I will reflect the sternocleidomastoid muscles. Here you can see this is the interjugular veins, and this is the along with the hypoglossal nerve. This part, it is considered as a superior root of the ansa cervicalis, and this is the part which is along with the jugular vein, interjugular vein, it is called the inferior root of the ansa cervicalis. Here you can see this is the inferior root of the ansa cervicalis. I will show you. Here you can see this is the inferior root of ansa cervicalis, which is formed by the C2 and C3 fibers, and this is the superior root of ansa cervicalis. Both are united. It makes the ansa cervicalis. This is the ansa cervicalis, and this root of the ansa cervicalis, which supplies to the uh, inferior belly of homoid. It also supplies to the sternum to hyoid, sternohyoid. It also supplies to the sternum to the thyroid, sternothyroid muscles. So ansa cervicalis, the it itself, it supplies to the three branches. This is the superior root, this is the inferior root, and both together, which makes it gives the branches to the inferior belly of homoid. This is the branches to the inferior belly of homoid, sternohyoid, branch to the sternohyoid, branch to the sternothyroid. So three branches from the ansa cervicalis. Superior root also gives branches to the superior belly of homoid. So this is the branch to the coming from the superior root. It is the branch to the superior belly of homoid, and also the fiber goes along with the hypoglossal nerve. On the here you can see this is a fiber which is supplied to the thyroid muscles. And lastly, this hypoglossal nerve, the fiber of the C1, which is goes along with the hypoglossal, and it gives the genioid muscles. But I have not dissected the branches to the genioid. But here you can see these branches to the thyroid, which is supplied by the C1 fibers, and also the fiber of the superior root also supplies to the superior belly of homoid. So carotid triangle, it contains the common carotid artery as well as the ansa cervicalis. Here you can see there is some variation. This normally the superior thyroid artery, which is arise from the external carotid artery, but in this case it is arise from before the bifurcation of the common carotid. So it is arise from the common carotid. It is not arise here in this cadaver. It is a variation. It arises from the common carotid. After that, there is a it bifurcates into the internal carotid and external carotid artery. Also, along with it, here my interjugular vein, which is broken from the upper sides. This is the interjugular vein. Along with it, there is a vagus nerve, and deep to the vagus, you can see there is a sympathetic chain. This is the sympathetic chain. So, interjugular vein, ansa cervicalis, branches of ansa cervicalis, vagus nerve, and sympathetic chain, branches of the external carotid artery, 5 branches emerging inside the carotid triangle. It is the one is the superior thyroid. Anteriorly, another 2 branches. It is the lingual artery. This is the facial artery. These are the 3 artery emerging anteriorly. Another 2 artery which is emerging on the posteriorly. It is the occipital, and uh, medially there is a one artery which is goes medially. This artery, it is the ascending pharyngeal. So these 5 artery which is emerging from the carotid triangle, one is the most medially, this is the emerging most medially, it is the ascending pharyngeal. This is the ascending pharyngeal. Another artery, this artery, this is a facial artery. You can see here, this is the facial artery. This is the hypoglossal nerve. Just below to it, this is a lingual artery, superior thyroid artery, and posteriorly the emerging artery, it is the occipital artery. These are the 5 branches which is emerging inside the carotid triangle. Floor of the carotid triangle, which is formed by the thyroid muscles. This is the anteriorly, and it is thyroid. Above by the upper part, there is a hyoglossus. Here you can see hyoglossus. On the back side, on the posterior side, middle and inferior constrictor muscles, which making the floor of the carotid triangles. So the carotid triangle, which is formed by the thyroid, hyoglossus on the anteriorly and superiorly, posteriorly, it is 2 muscles which makings the uh, pharynx. It is the middle and inferior constrictor. Here also you can see this superior laryngeal nerve which divide into the 2 branches. Superior laryngeal, it is a branch of the uh, this superior laryngeal, it is a branch of the vagus nerve, and this gives the internal carotid artery, internal laryngeal nerve, and this internal laryngeal nerve which is pierced along with the branches of the superior thyroid, it is the superior laryngeal artery which pierces to the thyroid membrane, and this internal laryngeal nerve goes along with the superior laryngeal artery and pierces to the thyroid membrane, and it supplies to the supraglottic part of the larynx. After that, here this lower nerve, here you can see this is the external laryngeal nerve. It goes along with the superior thyroid artery. So this external laryngeal nerve normally till up to the upper border of the thyroid gland. It is goes. This is the thyroid gland. I will reflect the infrared muscles, and you can see this thyroid glands. This uh, superior thyroid artery and external laryngeal nerve, which is passes go along with it till up to the upper border of the thyroid gland. Just near to the upper border of the thyroid gland, this external laryngeal pierces to the cricothyroid muscles. This is the cricothyroid muscles, and pierced by the cricothyroid by the external laryngeal nerve. At that level, the superior thyroid artery, which is separated from the external laryngeal nerve. So during the thyroidectomy, removal of the thyroid gland, the superior thyroid artery, which is ligated nearer to the gland, because in distal part or this part away from this, there is a superior thyroid artery and external laryngeal nerve both come with the together. So you have to remember. Another thing I will show you, there is so the content inside the carotid triangle are the main thing. It is the common carotid. Common carotid divided into the internal and external carotid and internal carotid artery. This is the dilated part of the internal carotid. It is the carotid sinus. Also, we already seen there is a ansa cervicalis. This is a superior root of the ansa cervicalis. This is the inferior root of the ansa cervicalis. This is the superior branch of the supplies to the superior belly of homoid and common carotid. And here we already dissected. This is the internal jugular veins. This is the internal jugular veins. Vagus nerve. This is the vagus nerve, sympathetic chain, and branches, 5 branches which is emerging inside the carotid triangle are the superior thyroid. Another is the lingual artery. This is a lingual artery. This one is a facial artery. Posteriorly, there is a occipital artery. All these branches of the 5 branches which is emerging inside the carotid triangle. And floor, we already discussed the carotid triangle. Last triangle, it is the muscular triangle, and this muscular triangle of the bounded by the anteriorly by the anterior midlines, posteriorly by the inferiorly by the anterior border of the sternocleidomastoid, posteriorly and superiorly by the superior belly of homoid. So this triangle, it is considered as a muscular triangle, and it contains the all infrared muscles. This is the anterior jugular veins, and this is a jugular arch. And here you can see the first muscle. It is the sternum to hyoid, sternohyoid, and along with the superior belly of homoid. Just below to it, sternum to the thyroid, sternothyroid, and thyroid muscles. So these are the content, and this all infrahead we already discussed. It is supplied by the ansa cervicalis nerves, and it is superior root, which is this is the C1 fiber which is passed along with the hypoglossal nerve, and the inferior root, it is formed by the C2 and C3 fibers, and it mainly ansa cervicalis is supplied to the infrahyoid muscles. And this superior root also gives the branches to the superior belly of homoid, and it also gives branches to the thyroid and genioid muscles along with the hypoglossal nerve. So this is about to the muscular triangle.